Good morning, or very early good morning to Luca and others. My name is Peter Von Alt. I work at MediCool Technologies. We are headquartered in beautiful Traverse City, Michigan, but we were founded at the Mayo Clinic to develop novel therapies for dangerous cardiac arrhythmias with an initial focus on something called post-operative atrial fibrillation, which is a very common complication following cardiac surgery. So each year in the US, there are over 500,000 open heart surgeries done. More than a third of those patients are typically going to go into post-op AFib as they're recovering from their surgery. And unfortunately for them, post-op AFib is associated with all kinds of adverse outcomes, including a 2 to 4-fold increased risk of stroke and a twofold increase of all-in mortality. And it also has a disproportionate impact on women who not only get it at a much higher rate than men, but also suffer a much higher mortality hazard. And lastly, for hospitals, it's a huge financial burden because the current treatments are not very effective, and are slow to work. So we've developed what we call Cool Cardio version, which uses a small temporarily implanted device to cool cardiac tissue to about 5 degrees Celsius to terminate episodes of AFib. We've demonstrated this in some preclinical work where we had a 65% success rate at 30 seconds. Within a minute, we had a 100% success rate at terminating episodes of AFib. And that led into an early first in human trial where we had an 83% success rate with an average time to termination of 21 seconds. All of this has been published in the Journal of the American College of Cardiology, and just recently, this past February, in the Heart Rhythm Society's Heart Rhythm O2. And I'm looking forward to talking to anybody else more about this if you're interested in what we're doing.